Those two questions are important for their own sake. Right? If we're going to allow voluntary active euthanasia, we have to ask what kind of safeguards we should put in place. They're also relevant to the question of whether we should have voluntary active euthanasia at all. Okay. I titled this presentation Consequentialist Objections. Right? And the consequential objections boil down to this. Even with the best set of safeguards, we cannot adequately control voluntary active euthanasia. If we allow it at all, even with the best set of safeguards, right, it will lead to too many cases where a person receives voluntary active euthanasia who should not receive voluntary active euthanasia. Okay. Now, some of the people who make that argument think it's wrong in itself anyway, and some people think, look, it's acceptable in some circumstances, but right, the potential dangers of mistakes and abuses are too large. But to determine whether or not that's true, we have to get an estimate of the extent to which there will be mistakes and abuses. More precisely, we have to figure out to what extent there'll be mistakes and abuses even with the best set of safeguards that we can devise. Having said that, right, it's important to notice that we can divide this question into two parts. Right? First, we have to ask what counts as a mistake or an abuse. So a good example of this involves a case like Sue Rodriguez. She contracted multiple sclerosis. So she had a degenerative nerve disease. She'd been an athlete, and she did not want to continue living with her physical disability. Now, some people would say if she receives voluntary active euthanasia, that is a mistake or an abuse. Other people would say, no, actually, she ought to receive it. So the first thing we have to do is figure out what counts as something that shouldn't happen. And that is, in a sense, a philosophical question. Right? That's a philosophical or an abstract ethical question. That's a question about what goals we should pursue, right? And what consequences we should avoid. There's also an empirical question. That is, once we figured out what kind of things we're trying to avoid, we have to figure out how likely it is that our safeguards will work. Okay? So once we figured out what we're safeguarding against, we have to try to figure out how effective the best possible set of safeguards will be at preventing the mistakes and abuses. Right? So to get the answer to the question, will our safeguards be adequate to make voluntary active euthanasia safe enough to allow? We have to ask the question, what counts as a consequence we need to avoid? Right? And how well will our best set of safeguards avoid those consequences?